meaning looking after yourself on the other side. Complementary and alternative medicine consists at its best of a lot of wellness treatments, and there's usually no evidence that these treatments improve your health. But some of them make you feel better. And feeling better is great, but that does not mean that you have improved your health. For example, if you like to get a massage, go ahead and get one. It's a wellness treatment. But don't claim that it improves your health, and do not call massage therapy. That's misuse of the word therapy. Another example is osteopathy and chiropractics. These treatments offer no clinical significant improvements when it's compared with classical physiotherapy or placebo treatments. So osteopathy and chiropractic treatments consist of physical contact between the treatment provider and the client, usually without sex, and requested and paid for by the client. And I call that prostitution light. Within 2 minutes.
Okay. Now, who shall we have next? I think we'll have Dr. May. We all know Dr. May because he came to our panel debate on religion and gave us the spirited defence of Christianity in medicine. And as we know, Dr. May is a GP in London, and he's been a GP for 12 years, but he's also the chair of Health Watch. So, Dr. May.
Thank you very much for having me back. It's a pleasure to be back. Aldous Huxley once wrote that medical science is making so much progress that soon none of us will be well. George Bernard Shaw wrote a play in 1906 called The Doctor's Dilemma, which joked about doctors deciding who to treat, when the reality was that the lucky patient would be more likely to be killed than made well. He says, when faced with suffering, there is an overwhelming pressure for the doctor to do something. Of course, medicine has been very effective since 1906 and has brought enormous benefits to the world. However, it is a victim of its own success. We want there to be a pill for every ill, what has been called the medicalisation of society. Medicine suffers from a fairly extreme case of the economic problem, that there are limited wants, and it's unlimited wants and limited resources. As our society ages, and as new technologies and new medicines develop, our dependence on healthcare increases, and so do the costs. The situation, I think, mirrors the environmental crisis and our addiction to fossil fuels. But it cannot and will not go on. Just as we have to look for alternatives to fossil fuels, we have to look, and I'll be careful about this, at alternatives to medicine, not alternative medicines. We need to live more modest lives. We know that social problems become medical problems as time passes, and yet we seem to be more reluctant to spend money on the social problem and happier spending it when they're on the medical consequences. We live with increasing obesity and spend our money on managing diabetes and heart problems. We allow social isolation to happen and then invest huge amounts of money on emergency admissions for frail elderly people who are not being cared for properly in the community. In my view, there is too much medicine, and it probably does us more harm than good.
I think we should really seriously consider this book called Skepticism and Medicine, and I think Dr. May is going to write it.
Can I just get in and say I'm already doing it?
All right. Yeah. Dr. Brewer, Colin Brewer, yes?
And it has it'll have a lot about ordinary medicine as well as quackery.
So, let's now choose Professor Susan Bewley, who is Professor of Complex Obstetrics at King's College and also a trustee of Health Watch. And you lead a very healthy life. Did you come on your bicycle today?
I did indeed. It's an evidence-based method of transport.
You have 2 minutes to make a pitch.
The question I was asked was, should we have more scepticism in conventional medicine? And the answer is undoubtedly yes. I just bring you the Lancet from 2 weeks ago, because everything is illustrated here. This paper Global, regional, national incidence, prevalence and years lived with disability for 301 acute and chronic diseases and injuries in 188 countries, 1990 to 2013, a systematic analysis of the Global Burden of Disease Study 2013. This is the most fantastic science. There are hundreds of collaborators, thousands of people working on it, millions of data points, and you can find out everything about every country in the world and every disease, the work that there is still there to be done. It's peer-reviewed, and also in here are articles about the responsibility and accountability for healthcare decisions, the global challenge. Despite the investment, evidence synthesis, too much research is wasted, too many decisions are not well informed, and there's substantial research for a median of 80% of our treatments. We do a lot of things wrong. There is very bad science. There's bias, there's money, and there's people and personalities. And even here we see transparency, some of the answers, transparency, declarations of interest, and digging up all the hard science that's hidden, thanks to the people like the All Trials campaign and the Cochrane collaboration. We've got to get to the data and the science. But here we have DS received research grants from Abbott, ABMF, AstraZeneca, Biocodox, Eli Lilly, GlaxoSmithKline, Jazz Pharmaceuticals. I go on, that's half the list. And right at the front, we have an editorial talking about NICE. I've chaired some committees for NICE. The processes are sound, and we have got really good science out there. But we are lacking something up there about kindness, compassion, and we don't talk about power and abuse and the money. And we don't talk about the real challenges, which are pain, disability and death. And that's why alternative medicine is there. It's offering something that we're not. But I think we use our tools, which are very powerful.
Thank you. Finally, we have Doctor. Is it Doctor? It's Doctor, not Mister.
No, it's, well, it's both,
Well,
but yes, let's, I'm not that picky about the, yeah.
Dr. Maciej Zitonski is a surgeon and a researcher. He is also one of the founders of Polish Skeptics Club, and he lives and works in the UK. He's a colleague of Thomas Witkowski, who we all met yesterday, and you can see that they have written a book on criticising a critique of psychology, which is on sale here, and there are posters up, so it's well publicised here. So,
Sold out, I'm afraid.
it's sold out. Right.
It sells itself, I mean, without the time.
You've got just 2 minutes, by the way.
Yes, right. Yeah, so thank you, Michael. Because we seem to have a lot of criticism of conventional medicine, I actually redesigned everything I was going to say and everything that I prepared before. And just to briefly touch on the massages as well. I've heard a lot of stories about them, and most of them had a happy ending. So it's probably not as bad as it sounds. But anyway, yeah. Well, anyway, what I will try to say, just to be a little bit more controversial, I'd actually like to defend conventional medicine. I think it's as good as it's ever been. There's some disturbed history. There's some evidence of poor science in the past. We all know about what happened in the 1980s. There's been a lot of quackery, but in the last 30 years, we probably had what has changed in medicine. What was a huge leap forward. And today, medicine actually offers relatively good science. It's probably the best, it's the most regulated and the most robust scientific procedures in the scientific world today, with the very respected and reputable journals. I'm not saying they're perfect, but they're as good as they can be, and probably the best they ever have. We have robust regulations and standards across the medicine in Western world that is actually moving to the other countries as well. We have quite skilled academic community that devoted to research with very good research practices. We have multiple sources of funding for research, and we have registries for clinical trials and lots of methods to funnel for missing data. We do the funnel plots, we have Cochrane collaboration, we have Nightingale. It's actually quite good. We have great products. And testing of medications in a scientific way is relatively new, but since the 1980s, most of them are actually proven efficacy. I'm not saying they work in everyone, but at least they work at least in some patients at some times, which 40 years ago was not necessarily the case. The constant surveillance of medications after they come to the market and are offered to patients, which is required by law, actually defines their safety as well. So yes, there are issues with medicine, but it's as good as it has ever been. And you all benefit from this, you and your families. You live longer, you live happier lives, and maybe you turn to alternative medicine because you're simply too healthy. And you're bored.
That's a very interesting range of opinions there, and I'm going to open it up to the audience in a moment, but I don't know whether any of the panelists and Professor Ernst have any comments to make, any points they want to raise that have been raised by the other panelists that they feel they want to.
I haven't made my point about skepticism yet.
Oh, do you want to? Oh, I'm sorry. Would you like to? I thought I'd given you your.
Yeah, I had half an hour to make my point, but half an hour is never enough. So I take another minute. I often get irritated by skepticism and skeptics who are skeptical for the sake of being skeptical. I know this is probably not a very popular thing to say this morning, but I say it nevertheless. For me, skepticism has to pursue an aim. And being a physician, the aim is obviously to improve healthcare. And if we lose the aim of skepticism in that sense, I think we're doing something wrong. Should we be skeptical in mainstream medicine? Of course. For the life of me, I cannot imagine a good doctor who is not skeptical. For the life of me, I cannot imagine a good scientist who is not skeptical. For me, it is like breathing. You cannot live if you don't breathe, and you cannot be a good doctor or scientist if you're not skeptical.
Okay.
Can I just respond to the point about integrative medicine and whether or not conventional medicine responds to that? I mean, it does every day in every patient that you see. As a GP, we're taught in our training to consider the ideas, the concerns and the expectations of every patient we see. And so we have to not just treat them as biological organisms that you give a tablet to make them well. You have to understand why they've come to you, what their worries are, what they hope that you might achieve. And we do this all the time. I think that probably part of the problem is that there's too much expectation on doctors, and there is a view that doctors will be able to solve all problems, and when they can't, and they point perhaps in other directions and say, well, maybe you need to talk to your employer or some other thing to account for your sort of distress experience that you're having, then people sometimes are unhappy with that and walk out and go to the alternative practitioner. I don't think it's that conventional doctors aren't doing that job of recognising that there are other things in life. I think we do it all the time.
Okay, anybody ask a question, raise a point? Yes?
How do you educate people that doctors can't solve everything? Because, as you say, people do expect doctors to do that.
You normally have 10 minutes, and you do your best, and I think you just learn language that communicates as well as you can, and you try to understand people, and you try to understand what it is that really is bringing them to see you, because it's often not the symptom itself, it's their concerns about the symptom. So you've got to delve and you've got to understand people's hidden agenda, what we call hidden agendas, what's behind the scenes of what's going on. And once you've understood that, then you're in a better place to address their concerns. So it's addressing their real concerns. I think doctors do fail if they don't do that, and if they just treat, well, you've got a headache, take some paracetamol.
But the person still goes off to the alternative practitioner and not to their employer in many cases.
Can I respond to that?
Yeah.
I'd rather spend an hour explaining to a patient why there is no point going to a homeopath than prescribing homeopathy medication in 5 minutes. You know, if a patient has complaints and there is nothing that medicine can offer, you should explain what you think is going on, what's the cause of the complaint, and you should explain that medicine has nothing to offer. But you should also explain that alternative therapies have nothing to offer, and protect the patient from being caught by an alternative healer who says, oh yes, I can cure this, oh yes, I can cure that, and they will go on prescribing acupuncture, homeopathy, whatever, until the patient is fed up with it. So I think it's our task to educate the patient, explain, and if it takes time, it takes time. But you know, never say, okay, I can't help you. Go to a homeopath, maybe you can do something. I think that's wrong.
I think it's a very interesting question where education begins, and I think it's a society-wide approach. I've watched over 40 years pregnancy outcomes get worse for mothers and for babies because of social trends where we're contracepting women out of their fertile years. And I try and speak about reproductive ageing, the impact of the obesity epidemic, many factors that have nothing to do with you and I, our individual control as the doctor and patient in front of me. They're to do with food policy, transport policy, education policies, the demonisation of young pregnancy, such that women at age 25, 26 think that their whole, well, I think we're making pregnancy toxic and children toxic society. But we've got a real problem because the other thing I opened yesterday was the fertility show. You can now go to Olympia and you can speak to the millionaires Eat West about, you know, tuna seared with lime, which boosts your fertility, or you can talk to complementary therapy, massager, and all the companies selling IVF, ART, surrogacy, international problems to be solved with assisted technologies. So reproduction is fascinating. It's a mess. We're seeing the loss of hope. We're seeing reproductive bereavement, not the death of ourselves, but the death of hope and the death of our reproducing ourselves. And it's a squillion-dollar industry. And to get facts in there, with the conventional people making masses of money out of desperate customers, and the unconventional alternative people making lots of money. And one has to sit there sympathetically with people in the general practice, or in the miscarriage clinic, or in the, turning up liver failure at 29 weeks with triplets. These are really, really difficult issues, and how can I say I haven't got the answers, or because everyone else is promising they've got the answers, and people are desperate.
When we say that alternative medicines don't work, we quite rightly mean they don't work in comparison to a placebo. And there often seems to be evidence that that placebo effect can be useful. I recall a paper I know that Dr. Ernst commented on, where people who went to a homeopath, there was a quite sophisticated design where it appeared that the homeopathic consultation resulted in people feeling better, although the homeopathic remedy did not result in people feeling better. So is there a place for, I'm pleased that at least one member of the panel is willing to spend an hour with their patients, but I don't think most conventional doctors have that time. So is there a place for something like alternative medicine, or perhaps support groups, or something like that, that will give people more time, more attention, which seems to be what some people want?
Well, I think doctors should spend time explaining things. You should give patients the attention they need. And if for whatever reason they need more than average attention, give it to them. Because if they go to an alternative healer, they will get, of course, attention for which they pay, but they also will get a pseudo-diagnosis like your chi is blocked, or your immune system is failing, or whatever. They will get a pseudo-diagnosis which actually makes them more sick than healthy, and they will get a fake treatment to which they might become addicted. You know, if this homeopath or whatever is a very nice man and you have a very nice conversation for an hour every week, you keep on going, spending money on paid attention that is not going to help you with the underlying disease if you have one. So I think people should be educated about their health, educated about what they can do themselves, lifestyle interventions, educated what is helpful and what is not, and and do it themselves. So it's in the private domain what you do about lifestyle interventions like a healthy diet, moving, doing sport, moving enough, having social contacts. Of course, people should get advice and help, but some things you have to do yourself, and don't get help from somebody who is not giving you the real help that you need.
I think it's here, just going back to your question, it's important to actually separate the two things, because you said spending an hour with a patient. I think it happens quite a lot, and I would say most doctors do it when it's necessary. I had a couple of years, like 11 of surgical experience in head and neck oncology, and the hour you invest with someone initially, it's not time wasted. Because if you don't do it and somebody refers back to alternative medicine, I will see them back, or one of my colleagues. It's just a matter of time. Cancers take, for example, a long time to develop. It's not a disease that you can catch overnight. So if I see a patient at a relatively early stage that for some reason I have a sense or he indicates that he will refer back to alternative treatments, I'll spend a day. Because in the long run, it still pays back. If I see him 3 years from now with the disease that I cannot really cure, this is going to take way longer than an hour I initially invest. So this happens. But we're talking here about diseases now, somebody with an actual organic medical problem. I think a lot of these questions that you touch here do not necessarily refer to diseases per se, that not to something that medicine can help with. And quite often I think that being able to separate where the real issues are. I mean, sometimes I refer, they might be different, and this has been flagged in the conversation today. Sometimes it's not a medical problem in the first place. It might be a social, psychological, or a need of attention or something else. This is not an area where medicine can actually help, and I think it's important to realize that. And it's both to doctors and for patients. It's important to realize this. Sometimes a referral to mental services is something that is needed, and and if it will not happen, or the doctors are reluctant to sort of steer the conversation that way, these patients are often lost to the alternative medicines. But we see them back. But then it's too late. If there is a problem, they come back when it's often too late.
Well, I agree with you. There's, for example, take the example of pain. Some people have pain and they say, well, okay, I've got pain, but I can still do this, that, and that, and go on holiday. Other people say, I have pain, so I can't do this, that, or the other thing. So people who suffer from chronic pain need psychosocial support. They need explanation of what's going on, and they need psychological help in how to cope with this pain problem. And if they have a good, realistic idea about the cause of the pain and what they can do themselves, that will keep them from going to seek help and shop around all the alternative medicine people who promise to cure it. So I agree with you that as doctors we should invest a lot of time explaining things to patients so they can make informed choices. If they know what's going on, if they feel safe about about the information, if they understand the information, they can make choices, and they can, they are safe and feel sure about the treatment they're choosing.
Yeah, that's the integration we should be talking about, not combining medicine with craft. These are two different issues.
I think we are not answering your question very well. I hear in your statement that undoubtedly treatments like homeopathy have a powerful placebo effect. Now, is that a justification for using homeopathy? The short answer is no. Why not? And that was covered in previous comments, because we should supply that in mainstream medicine. We should apply the empathy, etc., in mainstream medicine. But there are many other reasons as well. If we rely on the placebo effect only, we build our clinical medicine on sand. Placebo effects are unreliable, they are short-lasted, and they are not life-changing. Another issue is that placebo effects in that context would rely on us lying, and because I, as a homeopath, would have to say, take this remedy and it will help you. However, I should know that there's no content in this remedy, and that the evidence doesn't show that it helps patients beyond the placebo effect. So I would need to lie, and lying in clinical medicine and in life is not very ethical. So there are a whole host of reasons why the fact that a treatment conveys a placebo response in a patient is not a justification for its usage. However, in the whole field of alternative medicine research has realized that and has jumped on this bandwagon, and they're now speaking of real-life efficacy. I.e., not the efficacy versus placebo, but the efficacy that it does help patients. And that is so awkward and so misleading that we should be aware of it.
And don't forget that if you go to like a real doctor, you get the placebo effect as well, on top of what's prescribed. So you benefit twice. The placebo's effect is just as strong if you see a professional.
Another question here, and then one at the back, and several over here. So we'll take this one.
That's very nice to hear that you are optimistic about the possibility of educating people while doing the medical practice. But can you really do that? Do you really have that choice, or is that your choice to make? I hear very often from GPs and specialists alike that the greatest problem is that they don't have enough time to spend with the patient. And you touched on it a bit, and I do agree with that. So if that could be changed, if that could be done, so you could be given more time with the patient, would that make a huge change? Would that possibly mean that we rid the alternative practitioners from their ground, off their ground, by just spending more time and being able to educate and understand people more and act on it?
Well, I personally refuse to work in a clinic that limits my time with the patient. In a waiting room, it's
private clinics.
It's a waiting room, and there's reason for it. You wait till it's your turn. And if I need 45 minutes or an hour with the patient, I simply take it, because I hate to do my work only half. So it's not good that managers press us into time slots and limit our time with patients. And we doctors should protest against that.
We should protest. We should protest, but we shouldn't pretend that we haven't got jobs. And if you see one patient in an hour and I can see 4, and actually I could be as efficient at getting their diagnosis, giving them some, whatever it is, pills, not pills, saying actually I can't help you, but I think you could see my colleague who's cheaper because she's a nurse or a midwife. Or I think you can go and have self-help, or I can use the techniques of motivational interviewing that I've been taught to make things more efficient. We're talking jobs and costs, and the best use of the best value of the taxpayers' money is an efficient system, not one that's determined by the people. The inverse care law, which is well written up by Tudor Hart, which is where the most well off and the least unhealthy get the largest chunks of the healthcare budget, the education budget, and so forth. So there's some scientifically known forces about time in consultation rooms driven by money. We have to keep talking about money, and I don't earn very much anymore. That declaration of interest, like many of the people here, we make royalties on the books.
Time spent with the patients, often we have in mind our general practitioners, so I think Dr. May may want to say something.
Well, I agree with Susan. Time isn't a luxury that we can afford in that sense, but I'm not sure how much it is needed. I don't think in a GP context I need an hour or even 15 minutes for every patient. If someone has a minor viral upper respiratory tract infection, honestly, I can deal with that normally in about 3 minutes. It's very quick, and I've learnt the skills of reassurance within a very short period of time. I can use what may be considered to be placebo effects. I don't know, this might be an interesting discussion. If I get my stethoscope out and put it on in a particularly dramatic fashion, listen to someone's chest in a very authoritative way, then often that's very reassuring, and people can be, even though, to be honest, with most colds I wouldn't think that was necessary. It's you can identify it just by the runny nose when they walk in the room, and you don't need to check whether they've got pneumonia. But if you do get a stethoscope out, you can often speed up the consultation. So sometimes they can go very quickly, but sometimes you need more time. We operate a walk-in clinic as our practice. We often have 80 people in the waiting room. If I spent an hour with each of them, I would take 3 days to do the morning's clinic, and I can't do that. But we're flexible with the time. Sometimes we spend 15 minutes. Occasionally I spend 25 minutes with a patient, and sometimes that's necessary. I think there's a slight fear that seems to be coming across that they're going to walk out and go to the alternative practitioner. It's not my experience. Maybe it's because I work in inner city London, and maybe it's because I don't have a middle class population. They're generally quite poor. They're not going to alternative practitioners. The main concern with lack of time is that some people have complex illnesses and they need time to deal with the illnesses. It's not that they're going to walk out and see a quack.
I agree. And don't forget that the education doesn't have to happen in the doctor's room. There's research that says that whatever happens when you're speaking to your doctor, you're going to forget the moment you shut your door. So no, it is. It is. So the education can have forms. Lots of different forms. It can be websites, videos, leaflets that are being handed out, bringing the patients back. There's lots of different techniques. It's not about time. Time is a resource, and if used wisely, it can be used well to educate people on what's important.
There is evidence that it's an inverse relationship in 10 minutes. If you have the doctor talking for 1 minute or 9 minutes,